Okay. We'll be going live soon.
Great. And how long will the interview be?
Good evening, salam alaikum, and welcome to tonight's episode of Talking Point. I'm your host, Syed Neaz Ahmad. Well, normally I would start with in our studios today, but because of the pandemic, we have been doing it online, Skype, Zoom, so most of the time our guests are away, far away sometimes. Today's guest is based in New York. She is Silvana Qadir Sinha. She is an attorney and an entrepreneur with a passion for innovative, impactful approaches to governance and international developments. She has advised governments in Afghanistan, the Middle East, and Asia on governance, I hope good governance, and legal reforms. She is based in New York. She has attended Columbia University and Harvard. Welcome to the show, Silvana. How are you today? Can you hear me?
Yes.
I can't see you. The picture is not on. Yes, good. I can see you too. Can you see me?
Great. I can see you, yes.
Right. I said welcome to the show, and how are you today?
Thank you for having me. I'm doing well, thank you.
Thank you. This concept of prava, the beam of life, the ray of health, I understand that it has some special significance for you personally. And how did you, I mean, having studied law and government and politics, you went into something which is far away from what you studied.
Yes. Well, I was kind of chasing impact in my life and my work, and I had been visiting Bangladesh for a family wedding when my mother was hospitalized at one of the top private hospitals in Bangladesh for a basic appendectomy. And it was very eye-opening for me. I had never lived in Bangladesh before. I was born and raised in the United States. And I just realized the limitations and challenges of the system and observed, based on my background and experience working in emerging markets and working in international law, representing investors who had invested in emerging markets, as well as working in development at the World Bank and other places. I observed that it was a really interesting moment in Bangladesh's growth trajectory, and that although there was huge demand and understanding of quality healthcare, and billions of dollars going outside of the country every year for people who were seeking quality care. And every day, thousands of Bangladeshis traveling abroad for care. There were very limited quality, affordable options in the country. And so I thought, Bangladeshis deserve to have healthcare they can afford and trust without having to leave their country. So I saw an opportunity and a real need. And so that was, I had the idea about almost 6 years ago and moved to Bangladesh 5 years ago to build the company.
But what I understand is that we are providing something which is like our NHS, National Health Service in London, in UK. You are not providing the real, you don't have hospitals, but you are providing medical consultations and investigations, right?
Correct, yes. No, it's very kind of you to compare us to the NHS. We were certainly inspired by elements of the NHS's work. The concept is centered around family health. And really starting, with the cradle to grave concept that the NHS promotes. The idea is we are your first call. Anything goes wrong, you contact us first. And anything you need in an outpatient setting, you can access at Brava. That includes outpatient procedures, as you mentioned, investigations. There's a huge issue of quality diagnostics in Bangladesh. There's only one internationally accredited lab. And so it's not uncommon for patients to send their blood samples to 5 or 6 different facilities and to get back that same number of different results. So our lab is set up according to international standards. And our doctors are really practicing international protocols and clinical standards. We take note of the NICE guidelines in the United Kingdom, the National Institutes of Clinical Excellence, as well as CDC and WHO protocols in terms of the type of care that the doctors practice as well. So really trying to draw inspiration and use technology to improve efficiency in the system as well as access.
But with all the facilities that you have and you are accessing on, you would still be dependent on the local hospitals because you're not providing the hospital care. You're only investigating and finding out and providing the consultation.
That's true, yes. But, that's part of the change that we're trying to engender is certainly in some cases, some patients will require hospital care, but the fact is 80 to 90% of healthcare needs can be addressed in an outpatient setting. And so we really want to shift. Right now in Bangladesh, the cultural trend is anything goes wrong, patients go directly to the hospital.
Yeah.
Whereas what we're trying to promote is actually come to us first. We'd like to prevent you from having to enter a hospital, which is, as you must know, particularly important in the current situation where we're dealing with a global pandemic and we're really trying to reduce flooding of the hospitals and reduce burden on that part of the system so that they can focus, hospitals to be focused on the most acute cases. Whereas, as I mentioned, most cases can be dealt with in an outpatient setting.
Previously, as far as I can remember, there used to be doctors in every area, and they would practice, and they were the first port of call. So we would go there, and whatever they suggested, we'll go to the pharmacy, get the medicine, and we were treated, which is very much like we have here, NHS, GPs, local GPs, family doctors, see. But I think probably there is a huge gap between the number of doctors and the number of patients in Bangladesh. So that facility is not there, and then there is a great demand on doctors to provide services, either this hospital, this clinic, that clinic, and then with so many medical colleges operating, the professors, they are teaching at different colleges, and they are rushing between this place and that place. And in addition to that, they also have their own practice in the evening or sometime during the day. See. So there's a lot of pressure on the doctors, consultants, the professors, and all the paramedics. See. And it's good for making money. Yes, fantastic opportunities. But what sort of services are we getting? See, because we have about 4 or 5 top hospitals in Dhaka. And the rest are, I do not know what they are. There is no dearth of diagnostic centers and clinics and maternity clinics. In every area you have so many. But where are the doctors? Are they properly qualified? Are they really providing the facilities and the treatment that is really needed? See? Or is it just everything is being swept under the carpet? What is your opinion on that? See? Because I know you are involved in something which is very basic, consultation and providing basic treatments. See? But you will still have to depend on the hospitals, and you have to cooperate with the other doctors who are operating in the field. Are you with me?
Well, so as I mentioned, 80 to 90% of cases can be addressed in an outpatient setting and do not require coordination with another facility. So most patients, we are very happy and able to treat in an integrated manner within our system. I hope that makes sense. I may not have explained it clearly before. It's actually not necessary for us to interact with other aspects of the system in 80 to 90% of cases. In fact, in less than 10% of cases, we do have to make referrals to other hospitals, and there's nothing we can do really to help those patients in the sense that we are not able to admit patients overnight. We're an outpatient facility. When I decided to start the company, I was really focused on where I felt I could have the maximum impact. And what we know is that we can have the maximum impact in actually preventing disease from escalating. So for example, when it comes to COVID, right? 51% of patients who are tested positive for COVID in Bangladesh are actually hospitalized. Prava has introduced a pilot to try to prevent those hospitalizations by offering remote care globally, the data suggests that 80% of patients, for example, can be treated at home. And based on our pilot, which basically based on a patient's risk profile, allows patients to be, to self-report their symptoms based on their different risk profile. And 86% of patients through our software tool and our remote management system we're able to avoid hospitalizations. And so what we're really trying to promote is the concept that if you are treated properly in an outpatient setting, even through a virtual care setting, you can avoid hospitalizations. And that's really what we're trying to promote. Now, you did mention a lot of really excellent points about the challenges of the care model and the care model generally in Bangladesh. In fact, I wouldn't say there's even one care model in Bangladesh. It's a very, very transactional system and very uncoordinated system, unfortunately. Those are things that we have to operate within, certainly, but with respect to our 90,000 patients, we can stay focused on treating them and really trying to prevent hospitalizations. And as I've mentioned, we do have data that our model has been able to reduce hospitalizations to date.
Well, I read somewhere that Bangladesh has a pluralistic healthcare system which is highly unregulated, as you just said, and consists mainly of 4 key factors, that is, 6 sectors rather, the government, number 2 is for-profit private sector, probably that is where you come in, not-for-profit sector, mainly NGOs, and international development organizations. So what is your part of the pie, the the private for-profit organizations or profit medical facilities providers? Because the rest is huge. Your part, I see, is very small, see. And I know with only one facility, you can't cater to all the needs of all the people in the world. And particularly in Dhaka, which has a huge population, huge density. You are based in Banani, but Dhaka is a sprawling city. It goes up to Ghazipur on the other side and beyond the river on the other side. So how can you, the providers of this private healthcare system, can increase this facility so that you can involve and provide facilities to a larger section of people? Have you given it a thought?
We're working on it. We're certainly working on it every day. I mean, everything has to start somewhere. Even BRAC started as a relatively small organization and has now achieved scale to be the largest NGO in the world. So we are starting small, certainly, as you mentioned. We have one 10-story building in downtown Dhaka, and we have 90,000 patients, but we're growing very fast. We've doubled our patient base in the last 5 months. And we're actually raising capital so that we can expand our model. We'd love to expand so that we can serve the urban middle class throughout Bangladesh. And so, we'd love to scale up. We have a plan to build out more than 30 centers in the next few years. And we're also adding on to our virtual care services so that patients can reach us virtually, even without having to come and visit the clinics. And even we've already rolled that out, actually. We have patients from all over the country that are contacting us.
How do you see the government spending on healthcare system? Because it is, as I see, if I compare with other countries, it is appallingly low. In 2017, it was $36. While countries like Tunisia, 251, Sudan, 194, Bhutan, which most people would consider a very poor country, $97. So where do we stand? I mean, we seem to be spending, is there something wrong with our sense of using our money or where it should go? Because the health is the most important thing for any as you have mentioned somewhere, this emerging tiger of Asia. If the health of the tiger is not good, the tiger is as good as a fox.
Absolutely. I completely agree. Unfortunately, per capita, Bangladesh's spending on healthcare is one of the lowest in the world. And in fact, the interesting thing is Bangladesh has made tremendous strides in terms of social development indicators. Life expectancy is higher than parts of London and New York City, which are 2 of the richest places in the world. But that is largely, you mentioned the government sector, you mentioned number two for the for-profit sector. I would not put it in that order. I would say that actually the NGO sector has done a tremendous job in terms of largely based on investments made in primary care, improvements in vaccination rates, reductions in maternal, newborn, and child mortality rates. And all of that has happened not because the government has spent, but the government has opened the path for organizations like BRAC and Grameen and Sides of the Foundation, other NGOs to actually step in and provide really important needed services. But certainly we would love to see our government invest further. There's an article in the Lancet today that criticizes the fact that the government hospitals are charging for testing, for COVID testing, which is making it less accessible, unfortunately, to the masses. And, but Bangladesh also has its own challenges, and the donor community, it would be great if the donor community could step up and help us during a pandemic. But of course, the entire world has been stretched, and the limitations of our health systems have been stretched all over the world, including in countries like the United Kingdom.
Well, that's all very good, and we are concentrating on the urban centers, you see, but 70 to 80% of the population lives in rural areas, you see. And every year I go to Bangladesh, I travel up and down, just out of curiosity, not being on any, having any assignment or on job. Okay. I understand that we need to take a break, commercial break, and then when we come back, we'll try to go to the rural area of Bangladesh and explore how can the health structure can be instituted there and we can improve. Okay? We'll take a break now.
Sounds good. Thank you.
Thank you.